Warning. Listening to this show may result in increased levels of inspiration, motivation, and innovation. Side effects can include the immediate urge to take massive action to build a better business and life for yourself and others. You've been warned. Welcome to Influencers Radio with your host, Jack Mize.
And welcome back to another episode of Influencers Radio. You know, when it comes to first impressions, your smile is one of the first things people notice. It can have a significant impact on many aspects of your life, both personally and professionally. And not just the way you look, but also the way you feel. And unfortunately, many of us are self-conscious about our smiles, maybe because of missing, worn, chipped, crooked, or gapped teeth. We feel judged by others, and we don't smile or laugh as much as we want to or should. It can play a big role in our self-confidence, as well as our physical and mental well-being. Well, my guest today is Dr. Mansi Oza. She is a cosmetic and general dentist who specializes in helping people who are self-conscious about their smiles and not only want to look their best, but also want to live a long, healthy life by understanding the importance of their oral health. By listening to their goals, she creates a customized treatment plan that gives her patients the confidence to smile and laugh again with all their heart. Dr. Oza, welcome to Influencers Radio.
Thank you, Jack. I'm excited and honored to be here.
Well, I'm really happy that you have come here because, you know, this is a topic that a lot of people, whether they are, looking into cosmetic dentistry, whether they thought about it, and regardless of their thoughts about it, they just don't talk about it. And I think there's a lot of myths and misconceptions around it. So the first thing that I would like to tackle is the notion that cosmetic dentistry is just about vanity. And, I know it can have some very positive impacts on physical and mental health as well. Can you explain why that is?
Yes, absolutely. So you hit a lot of points already. So mentally, about 68% of people notice a person's smile first when they meet them for the first time. And people who do not have straight or beautiful smile know this. So a lot of people come to me because they want to look good. But what I see if I were to give you an example, let's say if someone has crooked teeth, by correcting that with something as simple as Invisalign, we are putting the teeth back into a position where they should be. So every time we eat or bite into our foods, the pressure that we put on our teeth is directed straight down the jawbone, which is how it should be. Otherwise, if the teeth are uneven, then we are putting uneven pressure on the teeth and we are not grinding our foods properly, not really getting enough nutrition out of it. Also, you cannot clean the teeth in between, and that leads to a lot of food infection, plaque buildup, and inflammation in the mouth, which severely affects your general health. So, I feel that aesthetics is a side benefit of nice, healthy, pleasant smile.
And I think that's important for a lot of people to understand, because there's people who say, I don't care what my teeth look like. I'm not that vain. But in reality, just like you said, and I think that's a perfect way to say it, that the aesthetics are a side benefit.
Right, exactly. And we function better. So when we function better, we talk better, we eat our food better, we get our nutrition properly out of our food. So we lead a long, healthy, good life.
Well, you mentioned the Invisalign, but what are some of the different types of, when people think of cosmetic dentistry? Because I know there's things that are probably, and I'm just assuming that that the Invisalign is kind of one of the kind of least, I don't know what you would call it, invasive or obstructive or what the right term is. But there's a lot of things that beyond just straightening teeth? Because there's people that I'm sure that need to replace teeth, need to have teeth removed and put back. What are some of the different extents of correcting that can be done?
Yeah, wonderful question. So I will start with something very simple that I did for my daughter, and I do it at no charge for my patients. So she actually got braces done, and she had those developmental bumps that most of us have on her front teeth, and she felt conscious about it. So all I had to do is just polish her teeth properly, and I saw immediate change in how she felt and how she started smiling. And I see the same thing for my patients. The second very simple thing that people can do is teeth whitening. You can get over-the-counter products, or if you want better results, you can go into a professional dental office and get that done. And just feeling that your teeth are, refreshed and nice and white, you start to smile more. So those are some very simple things. I personally am into really non-invasive treatments. So we have now developed flow composite cosmetic bonding. And we pre-plan everything, and then instead of removing any tooth structure, we kind of infuse some material which is permanently bonded on the teeth, and it looks as good as porcelain. We can also put porcelain veneers, which are like facets on the teeth. So those are some common cosmetic treatments. Now, if someone is missing teeth, then we can do dental implants. And I have some patients who did not have good teeth. They needed their teeth extracted, and we provided them with cosmetic dentures, and they are smiling more. So there are so many things we can do, and it doesn't have to cost thousands of dollars.
Yeah, and what do you say to the people that maybe think that it's too far gone? They haven't been to the dentist for years, and I know when I would joke growing up that I'd always tell people that my father was my dentist, and I'd follow up with, well, I mean, he didn't go to school for it or anything.
I see.
But when I finally started going to the dentist on my own, the first thing they said was, well, Jack, your teeth are okay, but the gums have got to go. Right. It goes to kind of just beyond the teeth. So when people that may think that it's too far gone, or, that's, they let it go so that this isn't even within reach for them. Is that just another one of those misconceptions, myths? Is there something that can be done for just about anybody, whatever their state of oral health is?
Yeah, absolutely. And those are the patients I see daily in my dental practice. So, I always tell them, and even myself, for any situation in life, in fact, that we can only move forward, right? So be clear about your goals. Why do you want to start? What is motivating you? And the more efforts you are going to put into your health and well-being, the longer things are going to last. But it's never too late. So I do need a thorough examination. So we do a lot more things than many general dentists would do. Like, we check your joints, we check the muscles for any inflammation, we check your tongue, we check the pH, your blood pressure, your nutrition, what do you eat for your diet, do you have any metals in your mouth that are causing toxicity, any mercury in your mouth. And we start there, and our hygienist is very gentle, wonderful, very encouraging. So we always start from gum up, because that forms the foundation, and the gum health can, if it's not good, then it can lead to diabetes, stroke, Alzheimer's disease. So we really want to make sure the foundation is good. And then we try to conserve as much a natural tooth structure as possible, because that's in your best interest. And from there, we develop a customized treatment plan based on your goals.
And, I know when what you do is it's a smile transformation, because that's what you're doing. You're taking from somebody that may have trained themselves not to smile because they're so self-conscious, and you transform that that smile, and you do it. You apply a holistic approach to these smile makeovers. Can you explain what that is? What is that smile transformation through a holistic approach?
So the holistic approach would mean that I look at their general health first. To give an example of a patient who recently found me, so he used to travel to a nearby city, and he got his complete makeover done, and he spent thousands, and he was frustrated that within 6 months, he had gotten cavities underneath those beautiful restorations. So he was kind of pacing in the operatory when I entered the room, and that's what he told me. He said, I'm very frustrated because I spent all this money, and now I have cavities all over. And I just glanced at his teeth, and I hadn't even looked at his medical history. And I immediately asked him that, do you have gastric reflux? And he said, yes. How do you know that? So I said, just by looking at your teeth. There has to be acidic pH in your mouth, and that's why you are destroying all this beautiful work. So that is a simple example of the holistic approach, meaning that I look at the whole person before we develop the treatment plan for him. So, for example, if someone is missing a tooth and they want dental implant done, but their vitamin D level is really low, the implant is not going to heal. So we look at all these aspects and treat the person as a whole.
Well, that could be incredibly important, because, like you say, someone to go through that much, procedures just to have it, that underlying, I can imagine how frustrating that would be for someone. And so I want to get into that as far as, how long these things can last, or what you can do to make them last. But what I really want to get into is some of the big ones. The big ones that I think are the most common, fears or obstacles I think that people have when it comes to dentistry in general. And I think probably the big one is it going to hurt? How bad is there? And there's people that I know that just, walking through the threshold of a dentist office just makes them break out in hives. So let's start with that. What are some of the ways that you deal with people's, fears of the pains or not, knowing what's about to happen?
Yeah, sure. So that is another great question. And I'll be honest, I personally do not like to go to a dentist or any other medical providers. I do feel anxious. So what I have done, from my years of practice, I've been doing it for 2 decades, and I've been a patient also. And, everyone's experiences combined. We have developed an amazing team. So they are so gentle, and we all try to listen to everyone's concerns first instead of just telling them what to do. So that is the first, I think that is one of the most important things we can do as providers. Besides that, we have a lot of comfort things that we have incorporated. So we have overhead TVs and neck pillows and blanket, lavender essential oils to help you calm down. We have some drug-free options. So we have these ear clips, and that can give you these positive vibes to help you calm down. We have nitrous oxide. I can also provide some medicines, which is you are still conscious, but you feel very relaxed. So those are some things that we can do to reduce the anxiety. We also invite our patients to ask any questions that they may have. We explain everything in detail. And I have found that doing all these things have helped a lot of our patients.
Yeah, so there's options. People have options. There's the people that,
absolutely,
no, I want to be right here with it. I'll deal with some pain. but I want to know what's going on, to the people that are like, no, give me the gas. I don't want to remember any of this. Right?
Yeah, absolutely. And a lot of people do this, and I still see some hesitations when I ask my patients, do you want the gas, the nitrous? And they're like, no, I feel anxious, but I'll be okay. And I want to say that please don't hesitate. We have really built all these things for your comfort, and it really makes it much easier to have the dental treatments done.
Well, so it sounds like you definitely have that handled, regardless of what their fear or anxiety level is. I think the next big thing that people always have when it comes to cosmetic dentistry or dentistry in general is what's this going to cost? How much am I going to have to pay? Is it something that insurance can cover? Or if I don't have insurance, is it something that is going to be, affordable to me, or something that, within my reach, financially. So can you talk a little bit about that, or on the different options? One, what some of these things may cost, and then also, different options depending on insurance or no insurance, that type of thing.
Yeah, sure. So depending on your goal and what you want to achieve. So like I said, some of the treatments are really simple, like teeth whitening in my practice. If you just want to freshen up your smile, starts at $79. And most, well, I shouldn't say most, but many people are satisfied just with that. And then there are some people who have completely worn down teeth to their gums, and we have to rehabilitate them, and that can be quite expensive. So it depends on what the plan is, and we can help choose some materials. So a lot of cost comes from the materials and methods that are chosen for the treatment, and different materials allow us to phase things out also. So let's say someone has an event coming up and they really want their front teeth to look good, but they also want to function well. So we can put the best material on the front teeth, and then we can put little less expensive material on the back teeth, and then gradually change it out as they are able to. So using different materials, phasing out treatment is one way we can reduce the cost. Some of the insurances do cover some treatments like dental implants or cosmetic bonding. So we have an amazing front office team, and they help our patients try to maximize their insurance benefits. And then we also offer financial options to really break up their monthly dues into smaller chunks, so the treatment becomes quite affordable.
Oh, so you really do make it, as available as possible with different options. So I think that's, besides the fear of pain, that's probably the next one that people have. And I think, people are really considering something like this, they should just go in and talk with you or talk with someone, because they may not know that a lot of these things are available.
That's right. And I forgot to mention, we also have an in-office discount plan. This is for patients who do not have a dental insurance, and we do not restrict it to certain procedures like the traditional insurance would. So we do include cosmetic treatment discounts in our in-office dental discount plan.
Yeah, well, you mentioned something I wanted to bring up, because I think it's fairly common when you talk about the teeth whitening. And there's some people that think, and that sounds really reasonable, what you said. I think, did you say $79? And I think some people say, maybe I'll try the teeth whitening toothpaste, or try the home treatments to save that. How comparable is that to having it done professionally in the office versus trying to do something like that yourself?
So it depends on how white they want their teeth to be. And I would definitely say, please do not go to salons which are not certified to treat anyone intraorally, because there's a lot that goes into teeth whitening treatment. we do examine everyone first before we start the dental treatment. So you asked about at-home treatments. I would strongly recommend not using the toothpaste because it contains a lot of abrasives and that can remove your tooth enamel. But teeth whitening strips that are available over the counter do work well. If you try that and if you are not satisfied with those results, then I would definitely suggest professional teeth whitening. And we have actually in my office, we are really known for our teeth whitening systems, and we have 3 different tiers. We have actually whitened Miss Maryland's teeth, Tiffany Franco-Smith from TLC's 90 Day Fiancé. She also came for teeth whitening. So we have our system down. We prescribe desensitizing toothpaste. We apply desensitizers. And we put Netflix or their favorite show on the overhead TV. And we like to have fun with them. So it is actually very fun and comfortable procedure in the office.
Well, then I think people are thinking, man, that might sign up, go in there, a little wine, a movie, while you work on my teeth.
No wine, but movie for sure.
Okay, a little gas and a movie.
That sounds better.
Yeah. So I guess one of the next questions, and you mentioned something about, someone has an event coming up or something like that they want the teeth. I think a lot of people think, if I go in and do this, am I going to have to walk around toothless if I need to get teeth replaced, if I need to do implants or anything like that? And I know this is a smile, transformation, but can you talk about the actual, the transition period from, getting started to completion? How much of that, is there any of those awkward times where they're really not going to want to smile, or there's something kind of, not right looking about their mouth? Because I think a lot of people, they may not want to start because they're afraid of what they're going to look like during that transition, and they may not have time to do that, or how long they need to be off work, or that type of thing. Can you tackle that?
Yeah, sure. So I feel very passionate about helping my patients smile more. So I would hate that, after any kind of transitional treatment, if they stop smiling, I would feel very sad myself. So the transitional period, let's say if we are doing a full smile makeover, we have already designed everything digitally first. So they are able to see their smile before I touch their teeth. So that's one thing. Once they approve it, if they want to try it out, then they do get a test drive. They also can get some temporary veneers or crowns on their teeth, so they can really try it out, and they almost look as good as the permanent. So there is nothing that they should feel conscious about during the transitional period. Dental implants, so if they are missing any teeth and if they have like a big gap, we can definitely address that with putting something temporary there. So the people won't even notice that you have a gap there. So there are lots of options there.
Well, you said something that I want to go back, and I want to make sure that we don't overlook this. You said you do like a preview of this. Can you explain how that works?
Yeah, sure. So if we are straightening your teeth, we use two brands, Invisalign or Sure Smile. So they provide smile simulations, so we can see the end result before we even start. So that is for teeth straightening. Now, if we are doing a full smile design with dental veneers and we are really enhancing your smile, then we plan everything digitally, so we can show you the simulation. After that, you can actually see the temporary smile in your mouth and you approve it before we start. So we can modify anything that you want, the shade or the shape or the bite when you are in that transitional smile. So that works really wonderfully. And we can also do a snap-on kind of appliance if you have an event coming up. So there's your teeth are not touched at all. It's an appliance on top of your teeth. So you can try that out too.
Wow! So it's almost like the patients see almost like a picture of themselves, like on a screen with their new smile, almost like it was photoshopped or something, so they can know actually how they're going to look beforehand.
Yeah, absolutely. Not Photoshop, but it's a software.
Right.
So but similar concept. Yeah, but it's done almost immediately, and they can see the difference that the treatment is going to make in how their teeth look and function.
Oh, that is amazing. What do you see? I don't know if it's a mistake, because I know it's just all a matter of taste and preference, but I see some people that go and get some of this done, and all of a sudden, I mean, their teeth are so white they hurt your eyes when you look at them. Do you see people that may want to go too far, and is that something that you consult or advise on? That I know you really want white teeth, but this may be a little too white. Do you consult with them on that?
So it's completely a personal preference, and like I said, we can try it out. So before we do anything permanent, they can try and see for themselves, try for a month or so, and I want them to be happy. So after trying, they will know for sure that, yes, they want really white smile, or someone, they choose from natural looking smile to really white smile because they thought that they would like little yellow tinge in their teeth. But then after trying it out for a month, they feel that no, they want to go a shade or two brighter. So, it's completely customizable.
Wow. Well, let's talk about the people that may need to go a lot deeper than, maybe straightening teeth or the whitening teeth, that it's actually into implants or need a full mouthful of teeth. I know there's options, and I know that when I think back to my grandparents, and they had their dentures, as they'd call them, their false teeth. It was kind of awkward, but I've heard that things have progressed or evolved since then. What is your take or advice when someone's looking at something between dentures and implants, and is there any situations where it may preclude one or the other from being an option?
Yeah, wonderful question again. So my advice would be to consider these options first, if possible, before you start getting your teeth removed, mainly because, after the teeth are removed from the jawbone, the bone starts to shrink. Some people lose the bone very quickly and some don't, but we want to plan ahead. So most people who wear full dentures, they feel that they are running a marathon in flip-flops, meaning that the tongue doesn't like it, especially the bottom denture. It keeps lifting up, and they feel conscious because it falls off and they are trying to talk. Many of my patients say that they cannot eat salads. So my advice would be to consider all these options beforehand, before you start losing all that bone. Now, if you have already lost all of your teeth and you want a better option, then we have to do the bone density scan, and we need to see how much bone there is left to place the dental implants. And based off of that and the patient's desire, some patients say, I want to go all in and I don't want anything coming out of your mouth. So they are looking at just completely implant-supported prosthesis, which is screwed in permanently in their mouth. And then there are less expensive options. We call them implant-supported dentures. So we put a few implants in the bone, and then the denture snaps onto it, and which is a less expensive option. But I would say anything that is supported by dental implants is a wonderful option. Compared to traditional dentures with no support at all.
Okay. So you're saying that like when it comes to implants, there's the options that, every tooth that's replaced has its own, what would you call it? Its own anchor there in the gums. That's such, but then there's also options where you can have a few of those anchors, and that's probably not the right term for it, but those anchors that other teeth can be attached to that aren't actually have that bolt and screw into it. Is that correct?
That's right. That's perfectly right. Yep.
Okay. Well, and is there any downside to that?
Not really. It actually improves everything. It improves how you talk, how you look, how you eat your food. So I think dental implants are wonderful for patients who have lost teeth, one tooth or multiple missing teeth or all missing teeth. And I think it is, the only thing is that it is an expensive procedure, and it is very important for patients to understand that implants also require maintenance. So I have a lot of patients who have reasonably good teeth, just cavities, and they are frustrated, and they say, just pull my teeth and I'm just going to get implants. So it is not as simple as that. You have to go to the dentist for your regular cleanings. You have to do more cleaning at home to maintain the dental implants. But if you are committed, it's a wonderful, wonderful option.
So I think that's where probably the next thing, and you actually talked a little bit about it, but the one gentleman that came in frustrated because of his, the cavities that he was having underneath. So, what is the time if somebody's thinking, well, how long is it last? Is it a permanent solution? You talked about there being maintenance. Can you go into that a little bit? Is there a lifespan for restorations where it has to be redone, or is it something that can last a lifetime if it's kept up with?
Yeah, so, again, it comes from your general health. So if your body is healthy, you're eating good nutrition, getting vitamins, vitamin D, everything. So then the health of your bone will be maintained really well. You have to do the mechanical cleaning, like brushing around the implants, using special tools to keep everything clean. But if you are doing everything, they do last a very long time. That doesn't mean that they won't fail. So for some people, unfortunately, body just rejects it and they have to have that redone. Or if there are some underlying medical conditions like osteoporosis or, sometimes diabetes, anything that compromises immunity, that can also affect the longevity of dental implant therapy. But for most people, they do last a long time.
Well, I guess on the opposite side, are there any people that are just not good candidates for a smile makeover? Is there anything that you can think of that would exclude them from this being an option?
Smile makeover, pretty much it works for pretty much everyone, as long as they are committed for their overall well-being and dental health. But smile makeover is everyone can do that. Dental implants, if someone is a smoker, they should definitely consider cutting back. Just overall general health, if they have certain body conditions, then it's possible that it may not last long, but usually most people qualify for these treatments.
Wow. So do you really have people that will come in and say, hey, pull them all. I want them all gone, and then put something, dentures or implants in. Do you see that? Is it common? And what's the kind of mind frame behind that?
I think, the points, I do see them. I would say once a week because of the area I work in. I work near Camp David in Thurmont, Maryland. And people, they're afraid of either pain or the cost. And either that or they have already tried a lot, but they were not told about the effect of diet and nutrition with their teeth. So even after getting all the treatments done, things start to fail and they just feel frustrated. So yeah, I do see them, and they just say, just pull them all and give me dentures. So yeah, it's very sad. Yeah.
Well, one of the things that you do that maybe a lot of people don't think about, because you clearly have a passion for helping people that are in this situation, and maybe not just the people that hey, I want a little bit wider smile, but there's some of these procedures can be life-changing for people, and just their mental attitude, their outlook on life, in general. Do you have any stories that you can share about that? And it must be tremendously satisfying for you to be able to play a role in that transformation for them.
Yeah, definitely. So I do provide a wide variety of dental treatments, and I feel that even if I do a small cavity, I feel that I have changed their life because I do it very precisely, and we apply ozone treatment before filling cavities, so there are no bacteria, all that stuff. But one case comes to mind. I was actually working for someone at the time, and I saw this 16-year-old young man. He had been to multiple dentists, and he admitted that, he had let things go, but he wanted to turn his life around. And he was told that he needed all of his teeth pulled and wear dentures. So he somehow ended up in our practice there. And he came for a second opinion. And he said, what do you think? So I said, I cannot make promises because you do have a lot of issues, but I don't have a heart to pull all of your teeth, because if we do it now, where would you be when you are 40, 50, 60 years old? So if you are committed, then I can try to help you. And he was 100% on board with it, and so was our team. So we gradually started cleaning everything up and did the gum therapy, made his foundation strong. Every time he came in, we told him how to clean his teeth better, what areas he was missing. I started removing cavities one tooth at a time, did quite a few root canals actually, and we started seeing a huge difference in how he looked at himself. And after we finished the entire smile makeover, his whole life completely changed. He got a job. He found a girlfriend, and he enrolled in college courses, and he just could not stop smiling. So I'm actually getting goosebumps right now as I'm talking about this, and it was just so rewarding. And, since then I've always done this for my patients, but that case is near and dear to my heart.
Oh, I can imagine. And 16, gosh, what a... I think how fortunate he is that he came into your office to see you and to give him that option rather than just pulling all those teeth.
Thank you.
That's just...
Thank you. He actually brought a lot of joy to all of us, and I'm thankful for him too. So.
Yeah, that's amazing. Like I said, it must be truly rewarding, and I have to ask you. What led you to do this? What led you to, one, to dentistry, but also to helping people to with these smile transformations? What fuels your passion behind that?
So my own experience, actually, when I was little, I was probably 6 or 7 years old. And I was getting sick pretty frequently. And one day I could not even keep the water down. So my parents got really worried, and my aunt is a doctor. So they took me to her hospital. I remember walking down that dark hallway in her hospital. My mom had a water bottle in her hand, and she was holding my hand, and I can still picturize this. And my aunt was waiting there. And when we reached to her, she asked if I had any water since morning, and I said no because I kept throwing up. And she said, just drink this water that your mom has, and I know nothing's going to happen. And I was very scared to do it because I didn't want to throw up there. But somehow I believed in her voice and confidence, whatever it was. And I drank the water, and really nothing happened. And, to that young me, I was amazed, and it felt like magic. And I remember in that precise moment, I felt like, hey, I want to create this magic too for other people. And since then, I always knew that I was going to be a doctor. It took me years to find my passion in dentistry, lots of training. And actually, in first year, when we were asked to carve teeth out of wax, I wasn't even sure if I found my right career path. But it was universe who called me into doing it. And I realized that I had always loved to work with my hands, so I can sculpt and I can knit and I can embroider. And I have always allowed the body and the biology and sciences. So dentistry is a combination of that. And I feel so grateful and, whatever helped me get into this field. And, I feel privileged that I'm able to help my patients through my gift.
Well, and you've certainly done a remarkable job of taking that inspiration and doing some amazing things, because I just, like I said, to be able to give people the gift of a smile and the ability to not be self-conscious, so conscious to laugh again, because that's just such a, to me, it's just one of the saddest things that people suppress their laughter because of that smile.
Yeah, it's so good. Yeah.
I just want to commend you for dedicating yourself to doing this and just having a huge impact on people's lives. And I want to definitely thank you for coming on here today and sharing this information, because I think even if people don't make a decision about what they want to do, I think you've at least dispelled some of those myths and misconceptions, and get them to at least take the step to find out what options that are available, even if they didn't think they were there before. So I definitely want to thank you for doing that.
Thank you. And you summarized it really well. And I do appreciate that you let me share my thoughts. We are all about making a positive difference. And I really hope that we did make some difference in someone's life today.
I think without a doubt. So how can people find out more, especially if they're in your area? What can people do to find out more about Dr. Mansi Oza, and to follow you, and to if they want to contact you to see what their options are? What's the best way for them to do that?
Yeah, sure. So we are actually not limited to our area. We have patients coming from all over the place. We just had a patient who came from South Carolina. So I would like to be open to anyone who wants to try to contact us. And my website is Thermont Smiles. So it's THURMONT smiles.com. And my social media handles, I'm very active on both Instagram and Facebook, and the handles are Thermont Smiles. So please feel free to reach out. If you don't know what your options are, I can definitely guide you, but don't hold yourself back.
Well, yeah, again, I think that's just why I consider you an influencer is you don't just provide the services, you actually give people hope and inspiration and motivation to do something about this. So thank you very much.
Thank you, Jack. I appreciate this.
All right, folks, there you have it. Dr. Oza is in Thurmont, Maryland, but like I said, people travel from all over to, take advantage for what she has to offer. So don't hesitate to do that. Again, that website is thurmontsmiles.com, THURMONTSMILES.com. And we'll have the links to that along with the social media links right there on the show post. Until next time on Influencers Radio, remember, you are the only real game changer.
You've been listening to Influencers Radio. To get all past shows and updates on future shows, visit influencersradio.com today.